Hi, my name is Hayes Holiday Saul. I'm a nurse who is about to graduate with my Master's of Science in Nursing degree from Fresno Pacific University. The article that I wrote for my master's project is titled Treatment Options for Hepatocellular Carcinoma. The two reasons I chose this particular topic, are twofold. The first reason is a little bit more personal. My mother actually died of hepatocellular carcinoma when I was 6 years old. Hers was more of an unknown etiology, primary cancer, which is very, very rare. The second reason being that hepatocellular carcinoma is the sixth leading cause of death worldwide and the third leading cause of cancer-related deaths. So to me, I feel like it's something that is underspoken about and needs to be more publicized so people really understand the poor prognosis and the severity of the disease. Hepatocellular carcinoma has a growing incident these days due to, unfortunately, the IV drug abuse that's going around, which leads to the chronic viral hepatitis, as well as alcoholism, which leads to cirrhosis of the liver, and then finally poor diet, which leads to fatty liver diseases. All of these diseases together or separately, chronic diseases can cause hepatocellular carcinoma, as we know, which is true of any cancer. Any chronic disease process can lead to cancer. The article that I wrote, it outlines the guidelines for treatment options, including the pros and cons of each treatment. The hope is that by spreading some kind of awareness of the severity of the disease, practitioners will take something as simple as elevated liver enzymes more seriously, leading to quicker interventions for these conditions that can lead to hepatocellular carcinoma. It kind of all started when I was in clinicals as well, and we do, yearly lab work on patients, and often earlier than a year based on their medications they're on, their comorbid factors, all of those things. And when we see elevated liver enzymes, some people just, oh, it's fine. Other people, oh, well, we'll just do a routine liver ultrasound just to have one on file so we know they don't have fatty liver disease. Well, why do we care about that? Because it can actually lead to hepatocellular carcinoma, which can very easily kill that patient. So that's kind of my other reasoning behind doing this, is just make people more aware of how deadly this disease is and why we're intervening as we are. After completion of my master's, I actually want to do a primary research project with a local hepatobiliary surgeon and his nurse practitioner. And it will look into the reasons why patients who are eligible for liver transplantation, which, as you will read in my paper, are very stern outlines and criteria for patients that can meet these criteria, but why these patients who have jumped through all the hoops and have met the criteria miraculously for this transplantation are not receiving the transplant. Liver transplant, if that is the correct option for whatever stage of the disease that you are in or for your next treatment modality, actually can increase survivability for 5 to 7 years for some patients, which is a long time that you get to spend with your friends and family, as opposed to not getting it and then dying within 6 months. So that primary research project will hopefully answer the question, is why are these patients who are eligible? What are the barriers that they're seeing to receiving them? There are some natural barriers that are seen through metastasis or spread of the disease that makes you outside the criteria. But if these patients are currently eligible, they're not receiving the transplant, then why? Did they not know they have to be on meds the rest of their life? Did they not know that they have to travel a little farther? Is it money? What are the reasons why they're not getting these transplants? And that, in turn, will help us be able to educate these patients better in their realistic outcomes and their realistic expectations of going through a liver transplant. I hope you enjoy the article, and I hope you have a great day.